I'm Beverly Kirk here with Julie Fischer, lead research scientist at the Department of Health Policy at George Washington University. You wrote part of this newly released report from the CSIS Global Health Policy Center on global health policy in the second Obama term, and specifically you wrote about health security. Talk a little bit about how the government's approach to health security has changed.
The U.S. government's approach to health security has changed over the last decade in a bipartisan way, in part as a reaction to new threats that the U.S. is facing that are really at the intersection of global public health and national security interests. President Obama in the first term built on the foundations of that work that had been done by previous administrations to focus in two ways. First, to bringing the global public health expertise within the U.S. government in our technical health agencies, to focus on issues that were before really framed as security issues. So bringing them into discussions of biosecurity, of discussions where experts focused on deliberate use of biological agents, and bringing the public health expertise in to say, okay, we can't just build systems to detect deliberately released agents, which is a kind of emerging infectious disease. We need to build the capacity to detect any unexpected event, any emerging or re-emerging infectious disease. And how do we go about building that capacity in a way that makes sense, that makes the best use of global health resources, so that we can detect a disease whether it is deliberately released, accidentally released from a laboratory, or naturally occurring in a way that makes the best use of our resources. So bringing the public health expertise into that dialogue was critical. And then the flip side of that was helping security agencies like the Departments of Defense and State that have resources and have interests in this area bring their resources to bear on issues that might have been seen previously as just health alone. So bringing their resources to look at agreements across borders to stop the spread of disease and to share information among partner countries and through organizations like the World Health Organization, so that we can get information on the spread of disease as quickly as possible and take action while those events are still relatively small and can be contained before they affect hundreds or thousands of vulnerable people.
How important is that information sharing? Because I read in the report where there's some resistance at points to how much information to share and what information to share.
Information sharing is absolutely critical to helping focus public health resources where they can do the most good. So global health security is really about taking the tools of public health and using them in a way to stop the spread of disease or limit events before they cross borders, before they affect large vulnerable populations who are very mobile in many cases. So to be able to bring those resources to the right place, you have to have the awareness of what events could be happening, of the scope of who's being affected, and to be able to assess that risk accurately in real time. That's difficult to do technically. It's difficult to have that awareness. It involves a lot of resources to conduct disease surveillance, which is the capacity to detect disease happening and assess it. It also requires political will. Beyond the technical demands, which are very real, the political will to share information across borders means that countries have to be able to trust that sharing information transparently, that an event is happening, will allow them to have access to resources, will allow them to partner with other countries to limit that event, while being aware that there are possible negative repercussions, that people are very afraid of disease, that trade and travel can be affected. And I think we saw a real case study of that in 2003 with the SARS outbreak. We need to be on the lookout for hot spots. We need to be on the lookout for understanding where those diseases emerge and helping the researchers and the governments in the places where that is most likely to happen develop the tools, if necessary, help them have the resources to detect and assess those events so that they can share information transparently with the rest of the world. Part of that is building the capacity of our partners to do that, not only through direct agreements, but internationally. I mentioned the World Health Organization as a place where that information sharing comes together, but WHO is also at the center of a new international agreement called the International Health Regulations. It was adopted in 2005. And the member states of the World Health Organization adopted that directly in response to concerns about emerging infectious diseases and the need to do something new, not just to detect diseases when they get to borders, but to develop the capacity globally to detect, assess, report, and respond to events wherever they are happening in real time. To achieve that, countries agreed to an unprecedented agreement, not just to share information transparently with WHO, which they did commit to do. 194 countries committed to sharing information with WHO about events that could have cross-border impact. The resources of the security community to look at what public health tools are needed to share information, to detect events, and to respond. And to bring the public health community into a dialogue that has security objectives. But there's also been some difficulty in resolving the priorities of those two communities. But they are both using the same tools. They're bringing the same resources to bear. They're bringing the same expertise to bear in many cases. And they're partnering with the same national governments and international organizations. So I would like to see the Obama administration in this second term take the opportunity to build on that momentum created in the first term, but at a technical level, make a smarter conversation across the agencies of the US government so that we can use the same technical terms, build on the same platforms. When we're talking to our partners, refer to the same programs and be more aware of the programs that are happening on the health side of the House and the security and health side of the House.
All right, Julie Fischer, thank you.
Thank you.